Welcome to our weekly live for COVID. We are going to be answering some of your questions. As I was getting ready to come on, I just got like a message from one of my colleagues who said the booster recommendations for adults, how there's different committees that look at this, and I just found out that the CDC's committee had a slightly different recommendation than what was being said yesterday. So I was just reading about that, and so I apologize for being a few minutes late, but I'm gonna have to look into that as we're talking, because slightly different wordage in terms of what the FDA's Advisory Committee on Immunization Practices is recommending. The CDC, so what happens is the FDA looks at the recommendations, and then the CDC's ACIP committee, which is the Advisory Committee on Immunization Practices, they make their own recommendations. So everybody has their eyes on what's going on. And so the FDA said something, and then CDC and ACIP are saying something slightly different, and I'll explain it, but I will have to look around because I just was reading it as we came on because it came out like about an hour ago. But thank you all for joining. So nice to see you all, or your waves coming in. So thank you so much. I'm Dr. Mona, and I do this every week to just kind of keep you up to date on what's going on with COVID, especially COVID with our children. I answer some of your questions for just adults too, what I know. And so we'll be going into that. As a reminder, I go into data. So I go into basic data in Florida, the United States. Someone asked last week if I could go into Texas data. I tried to get on the Texas Department of Health's website, but I'll be honest, it was very confusing getting their weekly trends. So what I do have for you is positivity rates, which may help. Like, what is the positivity rate overall? I don't have the children positivity rate. And I will also tell you all which states in the country have the top 10 best positivity rates, meaning under 5%, and which states are not. So that might help, just to put a frame of reference. Remember though that in my our highlight we have for COVID lives, there is now a link that you can go to that shares all of the positivity rates and risk by state and by region. So you can go to that highlight after you're done here, and it's again in the COVID live highlight. It's one of the links that I attached that goes over, it's called COVID Act Now, that's the website, and it breaks it down by state to state, what the positivity rate, how many cases per 100,000 people, which can really give you an idea of if your state or region is considered high transmission. But I'll kind of break it down briefly for you, but I don't have all of the states in front of me. I'm also going to be going over the promising data that was released by Pfizer. And what I mean is they said, hey everyone, we did a study, which we knew, and it showed promising results, which we knew. So now they are going to apply for emergency use authorization for children 5 to 11. So this is all stuff that we knew, but it became more official. And we will hopefully be getting the FDA's opinion after they review all of the data, side effects, whatnot, soon. But I'll be getting into what they said. Lastly, I'm going to be going over the booster recommendations for adults because there's been a lot of back and forth, and I will tell you what it is at this point. Remember, things can change any day, but as it stands as of now, I'll go over that. And lastly, because a lot of us are in Florida and Pete Associates is primarily based here, I did want to talk about DeSantis just hired a new Surgeon General who is changing a lot of the policies and recommendations. And he was mentioning that quarantine after being exposed in a school setting is not required anymore if the child is without symptoms. And I'll go into how that may be okay, but we have to think about how that won't be okay. And I'll get into all of that. And then you all will have time to ask questions. And of course, I will also go into how will this end? Like when will we see an end, and if there will be an end, and I'll go into that. So first I want to talk about data. So far, this is United States data, okay, not just Florida. 5.5 million children have had COVID so far, 225,000 in the last week, which is down every week in the last 2 weeks. So it's down from 243,000 the week prior. We are seeing downward trend nationally. We are seeing a downward trend in Florida. The hospitalization rate from the 17 states that have reported data is still 2.4%. So 2.4% of all COVID cases in children are getting hospitalized. Can other people hear me? Someone said they can't hear. I just want to make sure y'all can hear me. Maybe it's just the... If y'all can hear me, just say I can hear you, just so I know, so I don't continue. Or if not, you can hear. Okay, cool. Maybe, yeah. Okay, cool. Thank you guys. So Florida cases. Again, this is all adults and children. 75,000 in the last week, which is down from 100,000. Downward trend since August 20th. That's really great to hear, okay? And July 9th is when we started to see things go up. So it's been about 2.5 months of this. I apologize, July 9th. So 2.5 months of this kind of upward trend. So we are starting to see it come down. 11.2 positivity rate, which is the lowest we've seen since July 9th. This is also really good news. And under 12, the positivity rate in Florida for children under 12, 13%. And for 12 to 19-year-olds, 14.9%. This is down from 25% at one point. We are still in Florida at a positivity rate of 11.2%. In children, 13 to 14, 15%, okay? This is why I'm happy, is that this is amazing compared to where we were. We were at one point, 1 in 4 people were positive for COVID. Now it's almost 1 in 10, okay? This is really exciting, and I wanna just be very positive and uplifting that this is awesome. How we're gonna continue to keep that number down is the stuff that we were doing, which is vaccinating anyone that can and masking if we can, because what we don't want is it to creep back up. But basically anyone who's been exposed to COVID at this point we're getting exposed, and if we're not, we're protecting ourselves with vaccination and masking to protect our, the vulnerable. So this is really promising that since July 9th, we're seeing the lowest positivity rate in Florida. And I am just really happy, and I want to share this because I think it's very optimistic. Remember that the positivity rate is still 11% in the state. And so I don't want us to just, if you're in Florida, I don't want us to say, okay, again, this is over. It's not over, but it's reassuring compared to where we were. I am breathing a little bit more easily, knowing that things are improving, but we're still doing the same precautions that we were. Because I want to still see the continued reduction. But last week I mentioned that I wanted to see these numbers after Labor Day. And we are now 2.5 weeks out of Labor Day, and this is really reassuring. So how I want to jump now before I go into the Texas positivity rate. How are we going to get out of this, right? Like, people are asking, what is the end point here? So remember that the more people that are vaccinated, the better, for a few reasons. One, because the more people that are vaccinated, the less hospitalization, the less demand on our healthcare system. But the other thing that happens is the more people that are vaccinated, the less places this virus has to go, and the less places this virus goes, the less chance they mutate. So remember, Delta variants and variants are created in unvaccinated hosts. You don't get, if you have if you have the COVID vaccine and you get a breakthrough infection, it's gonna be mild. You're not creating variants. The variants are created in unvaccinated hosts. So what happens is, just say I was unvaccinated, I get COVID, the virus is like, this is a nice host. It changes its information, so it can become stronger and infect more people. But it can only do that in an unvaccinated host. So that is why we are preaching vaccination, because the more people that are vaccinated, the less chances of this virus getting into a host, mutating into something more problematic. So vaccines are part of this. The other thing is basically going to be the variants, like I mentioned. So we need to watch variants. Right now, there is no variant that is completely evading immunization. What I mean by that is when you look at all of these variants, the Mu, the Delta, all of these variants that have come out so far, yes, they may not be 100%, the vaccine that was created is not 100%, but it's showing some efficacy, 65 to 80% in terms of these variants, which is reassuring. Because again, the more people that are vaccinated, the less chance we have of breakthrough, and then that is kind of how we're going to get out of this. What we're feeling is that the next surge is pretty much going to happen now, because things are open, life is moving on. The next surge is going to happen when we see a new contagious variant that's more problematic than Delta. So that is how to look at this, right? Because right now, we've all either got vaccinated, we're all exposed, obviously hoping you're taking precautions for your kids. But the next time we're gonna see something major is going to be a variant that's either stronger than Delta or is evading immunity. And so that is, in a good way, this is we should look at optimism here, but we have to remember that we have to look at recommendations for boosters. We have to look at recommendations for vaccination, because we're not going to get out of this, because worldwide we have to also do this, right? America is leading, America is doing really well. I know Portugal is probably the head of the game in vaccinations, but other countries need to do vaccination too. Just now, the United States announced that they are donating, for every one American that's gotten a vaccine, they're donating 3 abroad, which is amazing, because this isn't going to completely end 100%. It's going to get better until the whole world is vaccinated, right? Because variants can continue to be created in unvaccinated communities across the world. And how does that get to us? International travel. So the goal now is we're doing our part as Americans, and now we have to help others and who can't afford to get the vaccinations. And this will end in that you're not going to see in America these major surges like we saw, unless there is a variant that's outsmarting vaccination. So that's what we're waiting, we don't want to happen. And how do we make that not happen? Vaccination. So that is what we're kind of looking at, right? And that is, to me, optimistic news when I look at the numbers coming down, right? The numbers are coming down. People are doing their normal activities. Delta is fading in Florida. Delta has made its rounds. Now we are patiently waiting, not excitedly, for the next variant to come. Is it going to be stronger than Delta? Is it going to fizzle out? We don't know. And unfortunately, we don't want to find out. That is why we need to vaccinate children. So I want to get into the next thing, which is why are we vaccinating children if they're not higher risk? So remember, the goal of vaccination is to reduce the chance of severity of illness, reduce spread, and also in this situation where it's eventually going to reduce variants, right? Because children, yes, are not high risk for complications, but they can get hospitalized, they can get long COVID, they can get MIS-C, which is the inflammatory condition. But by vaccinating them, we are reducing that chance of happening, and then we're also going to reduce the chance of mutations being created in children that are going to make this virus stronger. So we got to remember the goal of vaccination here. So when we vaccinate, it's not only for us, but it's for everyone, right? And when it does get authorized, it's not officially authorized yet. Remember, the Pfizer, I'm going to get into now the Pfizer data after I talk about Texas. But it's not authorized yet, but when it does, I will do a live and explain why we would recommend it, but we have to see the data and the FDA authorization be released, okay? So I wanted to say the positivity rate in Texas, because people were asking that, is 13%. Again, I don't have the trends, but that is really good because it was at 1.20+%. So we are also seeing that come down. Hospitalizations are still there, and we're going to see deaths rise, right? Because deaths are rising in adults, because remember, it's kind of delayed from hospitalizations. People are in the hospital for anywhere from 1 to 4 weeks, and then unfortunately some do pass away. So the deaths are going to lag, right? We're going to see deaths, and it's the reality of this, and which is why we want people to be vaccinated. The states that all have under 5% positivity rates, in order. It's like a beauty contest. I feel like I'm like giving like the top 10 of a beauty contest. Okay, Massachusetts is number 1. Rhode Island, DC, Vermont, California, Illinois, New York, Connecticut, Maine, and New Hampshire are all under 5%. So that is really exciting that you all are doing a great job. Thank you. The states that are high, I don't have all of the numbers, but they're anywhere from 25% or a 35% positivity rate to about a 13% positivity rate. These are the top 10 not so great. Idaho, Tennessee, South Dakota, Alabama, Montana, Oklahoma, Nebraska, West Virginia, Kentucky, and Texas. So Texas is at that top, but 13%. Idaho is at like a 40% right now. And remember, these are correlating with largely unvaccinated populations. So there's a direct correlation, which means the higher the unvaccinated rate, the higher the positivity rate. So that has been the case, and that's not going anywhere. I do want to talk about the promising data about Pfizer, and then I will talk about a few other things, and I'll open to questions. Okay, so what I wanted to reiterate is that the Pfizer did their study, and they said, hey everyone, our data looks good. And now they're going to issue, give all their data to the CDC so that they can review it, the FDA so that they can review it. The FDA is going to review it. They're going to decide if they want to do emergency use authorization. CDC and ACIP which is the Advisory Committee on Immunization Practices. They're also going to review it and give their recommendation. The AAP is also going to review it and give their recommendation. So that's likely going to come in the next month, okay? Because they have to issue for authorization and then everyone has to look at it. So shots in arms can happen probably by Halloween, definitely by mid-November for 5 to 11-year-olds if it gets authorized. So it's likely going to. I say if because the wordage I want to use is that we have to see the data and it has to be authorized before we say get it. None of us will say get it unless it's authorized. So that is why we say if. I'm very excited. It's very promising. Here's what it said. So the few things that they said: robust antibody response for kids 5 to 11 compared to adults. So they looked at antibody levels for these children at 1 month and 2 month post-vaccine, and the antibody response was similar to the response we see in adults, which shows amazing antibody and immunity. So that's awesome. 2,268 participants aged 5 to 11, and the dosing recommendation is 2 doses, 21 days apart, of 10 micrograms, which is different than the 12 and above, which was 30 micrograms, 21 days apart. Remember, dosing is done on the whole big group that they're looking at, right? They start low, so they start, maybe at 5 mics, and then they move up to find the level that gives the antibody response. So they settled at 10 micrograms for that age group was enough to give the antibody response. So side effects were comparative to the 16 to 25-year-old group. Body ache, soreness at the arm, fever, 24 to 36 hours after. They did not see any myocarditis in the 2,268 children, but they're still monitoring those children. Remember, myocarditis after the vaccine in the 16 plus group, more common in boys, chest pain, shortness of breath, that happened anywhere from about 2 days to a week after the vaccine. They did not see any of that in the vaccine participants in the study. Okay, which is really reassuring. And we understand that, yes, myocarditis is a possibility, but what the ACIP and FDA as well as the AAP are going to look at is this data promising? Is it okay to give? Do the benefits outweigh risk? And that is how recommendations will be made. So that is kind of what's happening, and I'll keep you posted. I may be on vacation when they announce the authorization, but I told my team that if I'm available, I will take the call from my vacation. I'm going to be visiting family to do this, but no promises. But just as a heads up, I may be on vacation. But it's so important to me. I even told my husband that, hey, this might come when we're on vacation. And he said, he's like, I understand. He's like, you got to do what you got to do. He's like, as long as it's not every day, like take the hour and do this. So I have a supportive husband, so we'll get that information to you, okay? The last thing I'm going to go over before I open up to the many questions I'm getting, and we'll do that for half an hour, is what Florida, the Surgeon General, said, that if your child is exposed to someone in their school with COVID and is not showing any symptoms, the parent can choose to not quarantine. So right now, remember that if you're exposed to COVID, you need to, and we read an article, so it's on our feed, so you can check that. So now if you're exposed to COVID, you're supposed to get tested, you're supposed to stay out for 10 days, okay? What they're saying is that if you're asymptomatic, you should be able to go back to school. The good thing I like about this, and I want to explain, please don't leave me before I tell you the not so great thing. The good thing is I agree that I feel like kids are going to miss a lot of school if they are sitting out for exposure, sitting out for every runny nose. I mean, I don't want kids to miss school. So I agree from that standpoint, the missing of school is very inconvenient for children if they're asymptomatic. If they have no symptoms and if they're wearing a mask, that makes sense. And it also is very hard for families because then you have to find childcare and it's hard. As a working mom, I get it. So that is the positive. The not so positive news I don't like about that is asymptomatic spread can happen, right? You could have COVID and spread it. So the only way this is going to work is if there are mask mandates. So you can't do this rule if you don't have a mask mandate. Why would a mask mandate help? A mask mandate is going to help because if you have a mask mandate, just say I am asymptomatic and I don't know it yet, okay, because I got exposed. The mask is adding another layer so that you're not spitting your germs and potentially spreading COVID asymptomatically. So the only way I would support this right now until we really get children vaccinated, right, and have the opportunity, would be if there are masking rules. Because when you add the masking rule to an asymptomatic child or an asymptomatic adult, you are adding a layer of protection, right? If that child is symptomatic, runny nose, fever, cough, we're gonna have to keep them home because then they had an exposure and you're testing them. But we're talking about asymptomatic children who have been exposed to COVID and are showing no symptoms. Can they go back? And I agree, possibly yes, but there has to be mask mandates. There's no way, in my opinion, that we can do that safely, because I feel like there may be asymptomatic spread, but there should be masking. In my opinion, I still think that we should test and make sure, right? The idea is that if you should get a test because it's just an easy thing that we can do. Now, if you're negative with the test, like just say you are asymptomatic, you had a COVID exposure, right? And you have no symptoms and your test is negative on a PCR. Can you go back without the 10 days? I think they should change the recommendations on that standpoint. But right now, remember that all the rules are based on schools also, and Florida's rules are different than the CDC's. So I personally don't know what rule your schools are going by, but it's important to remember that masking is important. Testing would be great because that's something that we can do just to assure. A PCR is a simple test that we can do if there was a COVID exposure. And if you do that PCR test, day 2 to 5 after exposure, and it's negative, then you maybe can go back without, waiting that full days. The other comment I have is the AAP The AAP has not made a comment about this, the Florida AAP chapter, so I'm not sure what their recommendations is. So remember, if anything changes, we will do an article or a blog or an article or a live to update you. But that's where we're at. So now I'm going to open up to questions for about 25 minutes, and I'm just going to scroll as far up as I can to get to again, I answer common questions. My pediatrician seems to think 2 to 5-year-olds won't be getting vaccinated. Do you think it's coming soon? So what's going to happen is right now 5 to 11 is the next on deck. The 6 months to 4-year-olds, so basically 6 months to 4 years and 364 days, that group is going to be released. That data is probably going to be released in November or December, with vaccines in arms maybe thighs by late December or January. The timeline still exists. That group, by the way, is looking at 3 micrograms for the dosing right now. But remember, the study is not complete. The children are still in the study, so they can't release the data until they have all of the follow-up. Remember, that's why things take time, is that they're looking at the children in the data, myocarditis, side effects, long-term, any symptoms 3 months out. Like, all of that is important for vaccine safety. So that's why we can't rush these things, and that's why there are these checks and balances. Any myocarditis in the 5 to 10-year-old data. So someone was asking about myocarditis data. We still don't have anything updated from the last time I did it. Next week, I will promise to check again and report. So, and I'll even write a blog next week if I have any updates. But right now, I don't have the exact numbers because they haven't released that on the CDC website, but I'll follow it up. From Massachusetts, yay, nice job keeping it under 5%. Pregnant people get vaccinated and it gives a little immunity to unborn baby. Everyone needs to get vaccinated. Correct. So, by the way, I didn't mention this. So the boosters for adults, I apologize. So I skipped over that. The boosters for adults, so right now the FDA had recommended boosters for adults for anyone 65 plus, anyone immunocompromised with an underlying illness. That includes pregnant people, because your immune system's not as great when you're pregnant, and recently pregnant also. And then also occupational workers that have high risk of exposure, ER doctors, people who are going to be exposed to COVID on a regular basis. That was the CDC that was the FDA recommendation. The CDC and their ACIP committee, which is the Advisory Committee on Immunizations, about 2 hours ago, and I just got, they said that definitely for pregnant people, definitely for immunocompromised, definitely for 65 plus. But in that healthcare workers, occupational workers, they said that it's not necessary and that it's really weighing benefit and risk because they trust the immunity of the vaccine. And I hear what they're saying. I think people should be given the option. Like, for example, my husband is an ER doctor. He's healthy, but he is exposed to COVID every single day. Not as much now, but he already has gotten the booster, and I'm gonna get the booster because I'm seeing kids sometimes with COVID. So I think it's a matter of personal choice also. And I think, I'll be honest, I think the recommendations got a little bit gung-ho, meaning it was done too preemptively and people were like, oh, get it, and then don't get it, and who's getting it? I will update and next week have the official answer, but right now the general population, it's not recommended. And the reason is not because they feel like, oh, well, you can handle it. It's that they trust the immunity enough that we want to protect the people who are more high risk for complications, because they may need a little boost of immunity, and the people who may be higher risk for exposure. And I'm talking about someone, remember at the beginning of the pandemic when we were allocating masks? The same group that would have needed masks, healthcare workers, people who are working with sick patients. Those are the people that I think they're talking about, because those are people who can be around respiratory droplets so much more. But the general population walking around with cases starting to come down, if you're immunized, not recommended. So again, things are kind of back and forth. So I apologize that it may not be clear today, because who are you following? I need the CDC's official recommendation, and I literally just read an article like 10 minutes before I got on. But we will update you. But general population, not necessary. 65 over, get it. Immunocompromised, 16 and plus, get it. And then if you are a healthcare worker, frontline worker, if you are high risk, you get it. Excuse me. If not, you don't have to. It's a choice. And so that's kind of what the recommendations are. But pregnant people are on it. Will you be vaccinating your son when it's available? I will be. So that's going to probably be end of December, January. I'm getting his flu shot. I got my flu shot today. That's why I have a little runny nose. You can get a little runny nose with the flu shot, but you won't get the flu. And so I'm getting his flu shot next week, and then COVID when it comes. But I like to be clear. I'm going to get it when I see the data and the CDC's recommendation as well as the AAP recommendation. Why do I say that? I believe in this. I obviously believe in it, but I haven't seen what the data is in the 6-month-old to 5-year-old group yet. And of course, that's important to me. And this is you should really hear us say this, because there is a checks and balances. Of course, pharmaceutical companies will do things and report it, but you have different people taking a look and making sure that it's in the best interest of the child. But yes, if it's authorized, which I imagine it will be, we will get it for our son. And we'll get it right away, like when it's available. Let's see. This is a good one. What are some main differences between symptoms of allergies and COVID? So allergies can look and this is the fall, so you're going to be seeing it. Allergies are going to have, you're going to have that runny nose. You can have like itchy nose, itchy eyes, watery eyes, puffy eyes. COVID is a virus, so it can look like runny nose, but you're not going to have the itchiness as much. You're not going to feel as like sinus pressure as much. You're going to have you could have cold symptoms, runny nose, but there's a difference in that itchiness component. Clear runny nose, just sniffles more with allergies. But it's tough right now, because could it be allergies? Could it be COVID? If you are a known allergy person, like you have allergies and your child has allergies, you'll know you'll know, right? Because you've gotten allergies before. But if it's new, I would say watch the eyes, if it's in the morning. Is it really in the morning? Is it really in the outside, like outdoors? COVID won't go away, or a virus won't go away like minute to minute, right? Or where you are. But if it's like you wake up and your eyes are puffy and then throughout the day it gets better, or you are outside and you're sneezing and you go inside and it's better, that's likely allergies versus COVID. Let's see. Great news on myocarditis. Absolutely great news. And I want to be clear, I know if maybe you haven't joined me before on my myocarditis talks. When we talk about myocarditis with the vaccine, myocarditis is basically a inflammation of the heart that happens after viruses. Okay, so flu, COVID, the actual COVID virus, enterovirus. There's so many viruses that cause myocarditis. So it's not unusual for us to take care of patients like this. It's also not unusual to hear that a vaccine can cause this as a side effect in small cases. Again, I will always keep updated on numbers, especially in the group of 16 plus. We obviously don't have numbers for so many small groups. But if I see data, I'll let you know. But it is still very small, meaning a small percentage of the billions of people that have gotten, 6 billion people have gotten the vaccine around the world. Very small amount are getting myocarditis, so from the vaccine. But we see way more myocarditis in the general population from viruses. So when you look at vaccines, you're looking at the benefit and risk. Do I want to take my chance getting COVID, getting myocarditis from COVID, or do I want to take a vaccine that has been proven to be safe and effective with the very small chance of a myocarditis risk that is easily not treated or monitored? There's no real treatment for myocarditis, but we have not seen any child or 16-year-old get myocarditis from COVID who has passed away or has complications from their myocarditis from the COVID vaccine, right? So that is what I want to explain, that yes, it can happen in very rare situations, but it's not causing any long-term harm for these teenage boys who have gotten the vaccine and ended up getting myocarditis. So when I look at it for my son, right, he's not a teenager, but I'm looking at it as that, right? I have seen myocarditis from children who get the flu illness. I've seen it from kids who get other viruses. It's not fun. It's a longer duration of treatment in terms of being monitored in the ICU. But for the COVID patients, in terms of the COVID vaccine patients that have myocarditis, maybe 2 to 4 days in the hospital and they get discharged. Monitoring, right? So it's really about what you're choosing, and do you want to take the chance or do you want to take something that is proven to be effective? And that's how I look at vaccination. And everything has side effects, but this vaccine is important. Amy, very nice. Everything has side effects. I mean, we forget this. Like, you walk out of your door and you can get hit by a car. You can get in a car accident. You can eat peanuts and get a peanut allergy. There's so many things that have side effects and risk, right? Antibiotics, everything in this world has a side effect potentially in terms of things that we put in our body. You put something on your skin and you have a reaction. I understand that, but with the research, and it's so important, the research behind vaccines shows when we look at common side effects, body aches, chills, okay, that's common because for some people that's the response of the immune system. But we are looking, is it anything problematic? And no child in any of the trials, no child to date has had adverse outcomes from the vaccine. But what we have seen is adverse outcomes from COVID illness, MIS-C, myocarditis, long COVID symptoms, which I've talked about before and I wrote an article about that's on our website. That is what the goal here is, right? Understanding that we are doing something that is going to protect. That's the goal of any vaccine, right? You can get any of your childhood vaccines. Yes, there's a chance of, fevers and illnesses and stuff like that, but you are doing what's best for your child because the data shows it. I mean, that's why I vaccinate for my son. That's why I promote vaccination, because it really is the best thing we can do to stop illnesses, protect other people from getting sick too. Remember, it's not just about us. Let's see, when do you think, I already answered a lot of these. So can children get monoclonal antibodies? So right now, monoclonal antibodies are FDA authorized, not FDA authorized, for 12-year-olds plus who have moderate to severe COVID symptoms, ill, like looking like they are like very sick. So that is a decision that you talk to the ER about, or the child's clinician about. But the general child who's 12 and asymptomatic, no. 12 and has a runny nose, no. It's a very sick child, like an ER visit or ER patient, or like in the office and looks like they have the flu. That's recommended, and there's different sites that have that, but 12-year-old plus. Eating indoors in California, okay, we still eat outdoors. This is your choice. Because your positivity rate is low, maybe you can also look at your county just to make sure you're not in like a county that's an outlier. But if your positivity rate is 3.8%, which is one of the best in the nations, by the way, like, congratulations. I used to be from California, so I'm like really proud of you, California. But I would be comfortable eating indoors. You may not. Everyone's different. But I was comfortable eating indoors in Florida when it was not like this, like Delta, because I felt like, if its transmission is low, but that is your personal choice. Remember, other illnesses exist besides COVID indoors. So if you're feeling like, I don't want to take my chance, outdoors is beautiful right now, do outdoors. I'm coming there in October. I would love to go get dinner. Just kidding, I can't do that. but I'll be probably eating outdoors. But I'm so excited to come home for a couple weeks. I'll be in Southern California. Can kids get a flu shot if they have some lingering congestion from a cold, or better to wait until all cleared up? I would get it. The only reason I would not do it is if your child has a fever in the last 24 hours. That is the only medical contraindication for getting the flu in terms of like those respiratory illnesses. Ryan recovered from just a viral illness that wasn't COVID, and I'm going to be getting it. I just have to figure out a day that I'm off to go give it to him. But yeah, you do not have to wait. I don't want you to wait. Why? Is that it could take like a week or so, 2 weeks to get better, and I don't want you to get sick with something else, like another flu or another illness, and then you miss your window. So I would do it. My advice is fever-free for 24 hours. If you really want to wait, as long as they're back to like their almost baseline temperament, even if they have a runny nose, do it. They don't have to be runny nose free. Let's see. Me and my husband are both vaccinated, but we are scared to vaccinate our daughter. She is 6. I want to address this, and then I'll do a couple more questions. So I want to first recognize that it is okay to feel scared and unsure. And I really want to applaud you for getting the vaccination for you and your partner. I think that's great. And I don't want families to feel, I'm going to do it. I trust it. You know, I got the vaccine first in like January. My husband got it like the second day it was approved, because we do trust the science and we do feel that. I trust the data so much in the 12 plus crowd to feel confident and comfortable saying that when this is authorized, I would want my patients to get it. And if Ryan was 5, I'd be getting it in October, November, or whenever it happens. But this is your choice. You can wait. But I don't want us to wait and then we open up susceptibility to COVID. Now, if you do wait, I'm going to talk about that because I don't want you to feel bad if you do wait. But I want you to consider it. I don't want you to say it's never going to happen. But if you wait because you want to see more data, okay, from that age group, you still want to do protection, right? You still want to make sure that you are vaccinated. The individuals around your child are vaccinated. I would love for your child to get the vaccine, but I also understand people and parents like, oh, I just feel like I want to wait. But because, that group has not had like the general population get data, but 2,200 children have gotten it. I get it. I understand that you may want to see more, but I would get it. And if you wait, don't forget about it, right? Don't say, well, I'm just never going to get it. It's fine, because it can play a big role in stopping the spread and, helping. But you have options. Now, my advice, like I said, is if you choose not to, we still should take precautions for our children. Masking should be happening. All of that should be happening just to reduce the chance of your child getting COVID. But I don't want parents to feel shamed, because I get it when we talk about vaccination for something that's new. For our kids, we can feel a little bit like, I trust vaccines, but part of me feels like I want to wait. I understand that sentiment, but I also want you to look at the trends for like the 12 plus. Look at the trends. Obviously, we're going to see 5 to 11. The AAP, the CDC, the FDA, these three groups, everyone is looking at the best interest of our children. It's not so much as a race to end this pandemic as a race to just help protect people, right? Like, I don't want us to think that, we just want this to end. No, we actually want to save lives and we want to protect people. And we would never recommend something or authorize something that wasn't in the best interest of a child. That's kind of my recommendation. Planning for a trip to Disney with my family in November. What recommendations would you give us? So I would look at the positivity rate when you come. You can look at the Florida Department of Health website. You can also look at the live that coincides right before, and I can answer that question again. If it keeps going in this downward trend, I would say, I would watch the precautions that are happening at that park. Usually what they're recommending right now is masking indoors, no masking outdoors, which I think is reasonable. And given cases keep coming down. But if there is another variant that comes around, I would want to give you other recommendations. But if it stands with the trend that is, I think going to Disney World is fine if your children are not high risk. Like, don't go with a newborn, don't go with a child who's immunocompromised at this point. We want to basically protect that risk. But I would be fine with it. But really just remembering to mask indoors. You don't have to mask outdoors, but following the recommendation and looking at what's happening with COVID at that time. Why did the CDC deny healthcare workers? I'm sad and anxious now. I know, and that's why I'm like, I don't know. It really just happened right now, and I wish there's the good thing about having a lot of committees involved is that you see a lot of opinions and people are thinking. But the negative is that you offered something and then you take it back. It feels off to me, and that you feel like, wait, I just was told I was going to get to do something and then you can't. I would rather have had it be like, hey, let's see, maybe this, and then so. Look, I know I'm not anxious. Like if I'm not allowed to get it, I want to be clear. Like if I'm not allowed to get it, I'm not gonna lose sleep over this. I do believe, I want to remind us that they are looking at just overall data. And the reason I'm not losing sleep about this is that I am vaccinated, right? And if they're looking at the data and show that even though immunity may wane like 60%, 70%, likely that you're gonna prevent this, with cases also coming down, I'm also like reassured, and I also still take precautions, right? So I'm not worried. I know everyone's different. I do think they should give the option based on the person's occupational exposure. Like my husband's ER doctor, like I think every ER doctor should have the option, given that they are exposed to a higher degree on a regular basis of very sick COVID patients if they come in. I'm not as exposed to very sick COVID patients. Maybe they have a little bit of a runny nose, but they have a mask. But my husband is doing intubations and having to have that person be unmasked and droplets flying. So that to me makes sense, that people who are going to be in the face of people who are super sick should get vaccinated, similar to the mask allocations earlier when this pandemic started, if that makes sense. So I'm not worried about it because I'm thinking about when this all started, who is that group that needed this? Who was the group that needed vaccines first? Who are the group that needed masking first? It was 65 plus, it was healthcare workers that were high risk for occupational exposure. And that's why I think they should kind of look at, but I hear you. I don't have I need to read. I didn't have time to read the official data because it literally just came out while I was putting my son to bed. So I'm sorry, but I'll update next week for sure if there's anything that happens. One more question, let's see. Actually, I'll do two more. Do you think kids will get the vaccine from big drive-through vaccine hubs or a pediatrician's office? I think it may be a combo. It may be drive-through and it may be a pediatrician's office. Depends on where you live. California loves you. I love California. I do. I'm so excited to come visit. I haven't been there in 2 years and I usually go every 6 months. So we are so excited to come. Very excited. When will Peds Associates have the flu vaccine? So some offices have it now, some do, and most offices will be getting it in stock. You can call your local office if you're unsure, but we will announce again when it's available. All supplies there. Just right now, certain insurances and certain offices have it. If your child was sick, okay, this is if your child was sick when it was their turn for the second vaccine, so you said you got the COVID and 21 days later, how long after do you have to get the second dose? So remember, it's minimum 21-day exposure. That's ideal, right? So now just say it's 21 days is on December 1st and your kid gets a flu or fever. You have to wait till your child is fever-free for 24 hours to be able to get the second dose. It's okay if that window is a little bit larger, right? 21 days is what was studied, but you don't have to start the series over. You would just get it when you're able to, and when the child is, fever-free. The last question I'll do is about weddings. So we have a wedding coming up. We have a 3-year-old toddler. Very hard for him to keep the mask on. I hear you. I think it's really hard for some toddlers. So here's what I would say. It depends on what the wedding, who's at the wedding, if it's outdoor, indoor, where you live. Remember, the factors that I look at: positivity rate in a community. So if you're in Idaho versus if you're in California, it's going to be very different recommendations because Idaho is through the roof right now with positivity rate. So if you're in a community with low positivity rate, like in California, you're surrounding most, if maybe the wedding has a vaccine recommendation or most of your friends are vaccinated, your risk is lower, right? If it's an outdoor wedding, your risk is lower. So it's really about making those choices. I can't make those choices for you because everyone has different risk assessment, but look at those things. Look at where you live. Look at who are the people at that wedding. Maybe they made a rule, everyone has to get COVID PCR tested. Some weddings are doing that, which I think is fantastic to reduce the chances. Yes, there's a chance of someone breaking through with an asymptomatic, but we want to just make sure everyone has a negative PCR. Everyone, if they have vaccine policy, maybe some weddings do to keep it safe. But look at what the rules are and then make that decision. that's kind of how I have to guide that, because there's no official recommendation, but you can think about those things. But if you live in an area with low transmission, your chances are lower. If you live in an area with high transmission, I'd be more concerned. So if you lived in Florida and the wedding was 3 weeks ago when Delta was going crazy, I would say not worth it, because I just don't feel like the benefit is outweighing the risk of just exposing our child. But now things are getting better. My advice may change. You all are so welcome. Okay, so I look forward to your lives all week. That's so nice. Well, I'm so happy to be here. Remember, I will be here every week. I don't know when that authorization is going to happen, but I will keep my eyes and ears open, I guess. But I will make sure to update you. Yes, I'll be back next week, and I will try to look into myocarditis more, just to see if there's any updated data on the vaccine, myocarditis in the community, all of that stuff. And if I can't find it, I'll let you all know. And I'm very excited that we could do this, and I will save this. You can also share if you found it helpful. Again, I will add a couple of resources as a link to our stories. Just if you want further reading, you can check our COVID Live highlight. Our COVID Live highlight has great information if you want more information. Otherwise, you can come here every week. But I wanted to attach that now that we have 10,000 followers, for people who like to read more or know where I get my information from. That way you can follow along. You're so welcome. Have a great Thursday.